Next, we are going to next topic. So match the USG sign in column A with their appropriate description or implication regarding fetal dummies in column B. Choose the correct option. So actually this question is incomplete. So here actually the correct option is D is for 1. This is the only correct option. Okay. So we will see about what are the signs and all we will see. So first is your Robert sign. So Robert sign is basically presence of air in aorta. Robert sign is presence of air in aorta. All of these are radiological signs seen in dead fetus. And this halo sign, this is Dual's halo sign. And this paddling sign, these are also important radiological changes that we see in deadborn. Halo sign, it is fetal scalp. You will see a halo above it. And sparling sign, it is overlapping of skull bone. Overlapping of skull bone. Okay, so these are the radiological sign and rest about the infanticide. So proximodistal means like it will start at the proximal part. Like it will start at the arm, then it will go to the forearm, then it will go to the finger, like proximal part of the body to the distal part of the body. This is how it usually progresses. That is proximodistal progression. That is which is most proximal, eyes. Then it will go to the jaw like that, proximal to distal. That is what proximodistal means. Clear? And I hope my audio is clear. So we will continue with the deadborn topic. So now I already told you Robert sign, it is presence of air, and halo sign, it is presence of a halo over the fetal head, which is basically due to the subcutaneous fat separation. Subcutaneous fat will separate and it will form a layer. Okay, it will look like a halo in the radiology. Clear? That is your Dual's halo sign. And sparling sign is nothing but overlapping of the skull bone. And all three, it is seen in deadborn. Clear? All these three signs, it will be seen in deadborn. Apart from the other radiological features that we can see is crowding of ribs. Crowding of rib. Hyperflexion of spine. Hyperflexion of spine. All these things are seen in the ultrasound. So these are the radiological signs that we see in deadborn. Now we will see like what is the main difference between liveborn, deadborn and stillborn. When do we call something as a deadborn and when do we call something as a liveborn or stillborn? So first we are starting with the deadborn. So to call a fetus as deadborn, to call a baby as a deadborn, there has to be like at least one of these three. First is rigor mortis, second is mummification, and third is adiposure. Clear? Like these two, it will together putrefaction or maceration. If any of these is present, then we can call it as a deadborn. To call as a deadborn, it has to have any of these four features. First, we will see about maceration. Here, do you see this peeling of skin, this reddish bloated baby? So, this is a macerated baby. This is a maceration. So, maceration is nothing but autolysis. We saw in decomposition, right? It consists of autolysis and putrefaction. This maceration is a autolysis. That is a aseptic process. It is a aseptic process. Clear? And maceration, you will get to see this peeling of skin. You will get to see peeling of skin. and you will see this reddish discoloration. Reddish discoloration. And this is the initial thing you will be noticing in a macerated baby. And apart from that, you can also see this mummification or adiposia. This baby here, it is mummified, or you can also see adiposia. So when there is entry of air, when there is entry of air into the uterus, entry of air to uterus, it will cause these putrefactive changes. It will cause the putrefaction, which will result in either mummification or adiposia formation, depending upon the conditions. Means if there is no liquor, so if there is no liquor, there will be mummification, and if there is adequate liquor, there will be formation of adiposia. Like I already told, if there is no water, it will be mummification. If there is presence of water, that is humidity, you will get adiposia. So either one of these findings, if you could see rigor or mummification or adiposia or maceration, if you see either one of these, you can call it as a case of dead bond. Clear? No issue with the dead bond, we can easily find out. Now the issue arises when the baby comes as a stillborn. So stillborn or liveborn. That is what we need to know. Now this is the important differentiation we have to know. So deadborn we will easily identify. Stillborn or liveborn, that is where the real problem comes in. So to differentiate between stillborn and liveborn, we have certain tests. But first of all, we will see what is a stillborn, what is a liveborn. Legally speaking, a liveborn is like after coming out fully expelled baby, if it breathes, if breathing present after full expulsion, it is a liveborn. Clear? Not inside the vagina or not during the delivery. If it cries, it is not a liveborn. After completely expelled from the mother, if it is breathing, it is a liveborn. Legally speaking, this is the definition of liveborn. Clear? And if does not show breathing, like while inside the uterus, it breathes. This is known as, or inside the vagina, it breathes. But after complete expulsion, no breathing. This means it is a case of stillborn. Clear? So once completely expelled, it has to have breathing. Then only we can call it as a liveborn. And the main differentiating factor is what? The differentiating factor is breathing. So we will look for certain changes in the lungs and in the body to identify whether breathing had happened or not. That is the basis of all the tests, and that is the important reason why we do autopsy in these stillborn, liveborn babies. So first, we will start with lungs. So in lungs, this first test is Fodry's test. Here what will happen is that once the respiration happens, okay, respiration happens and there will be blood vessel, the circulation will happen, right? There will be circulation and there will be blood inside the blood vessels in the lung. Okay, so because of that, the weight of the lung would increase. Weight of lung will increase from 35 gram to 70 gram. It will increase. This is the Fodry's test. Clear? Once the respiration happens, there will be circulation of blood inside the blood vessels in lungs, which will result in the increase in weight of the lungs. That is Fodry's test. Now, second, Placott's test. So, Placott's test, what will happen here is that, so in Placott's test, what they do is they will make a ratio of weight of lung to weight of baby. Now, once respiration happens, the ratio, it will decrease from 170 to 135. Ratio would decrease. Clear? So these are the two tests. First is Woodry's test, second is Placott's test. Done? Now, third is the Raygaard's test, and this is very important. And what we look for is the specific gravity. Specific gravity of lung. So once respiration happens, the specific gravity of the lung will change, which will result in the floating of lung. Floating of lung after respiration happens. Now, if you look at this picture here, this is the lung. Whole lung, heart, the bundle would be taken and it will be put inside a beaker containing water. Now, it is sinking, right? This is sinking. Sinking lung means no respiration. If the lung is floating, it means respiration might have taken place. Clear? And there are certain fallacies to this test, which means there is possibility for false positive and false negative in this test. So first, false positive means no respiration but lung floats. Right? This is false positive. Right? So this will happen where? First, putrefaction. Second, artificial respiration. Under these circumstances, even there had been no breathing, the lung will start to float. This is the false positive. Next, false negative. Here what will happen is that respiration had taken place, but lung sinks. Lung will sink. This happens where? This will happen in atelectasis. Atelectasis. Or the respiration was very, very feeble. Respiration was very, very feeble. Or under certain infections like pneumonia or syphilis. Under these conditions, the lung will sink even if the respiration had taken place. So, not just based upon the Raygaard's test, we can simply say the baby was live born or a stillborn. We have to consider all other factors also. Clear? Now, there are few other changes in lungs that we will notice. So, other lung changes. The one important change is the level of diaphragm. The level of diaphragm. It will be fourth to fifth rib if the respiration had not taken place. Okay, and it will go down to sixth rib if the respiration had taken place. Clear? This thing is important. Apart from that, you will also get to see certain changes in other part of the body. So first is the Breslau's test. In Breslau's test, the stomach will float in water. Stomach will float in water if respiration had taken place. Like what will happen if there is respiration, some air might have entered into the stomach also. So what we will do while doing the autopsy, we will ligate both end of the stomach and we will take the stomach and we will put it in a beaker. If air is present inside the stomach, it will float. So we can say respiration had taken place. And one more important thing in the stomach is that if there is presence of milk, in stomach, it is the surest sign of live born. Okay, this is the surest sign of live born. If there is milk inside the stomach, you can definitely say that it is a case of live born. Clear? And next, Redden's chest. Redden's chest is presence of air in middle ear. This is Redden's chest. If respiration has taken place, there will be air inside the middle ear compartment. This is Redden's chest. Clear? And while doing the autopsy, after doing all these tests, we will also do some other things to estimate the age of the fetus. So to estimate the age of the fetus, the first thing we do is rule of Hasse. So rule of Hasse, here what we will do is we will take the crown heel length, not crown rump, it is crown heel from head to toe. Clear? We will take crown heel length. And if it is less than 5, if it is less than 5 months, we will take the square root of the value. Square root of crown heel length. If it is more than 5, we will divide by 5. Clear? And the second part, it is also known as rule of Morrison. Okay, so they will give you length of the fetus, and you can, by taking the square root, you can identify the age of the fetus. Clear? And to identify the age, we also do ossification center checking. Okay, so ossification center, these three are important. So calcaneum, it will come by 5th month. Okay, by 5 months you can see. Talus 7, lower end of femur 9. All these three you can look for the presence of the ossification center, and it will also help in identifying the gestational age of the fetus. Clear?